Welcome back guys, I'm Cringista, first year medical student studying at Queen Mary University in London this year. I make videos on productivity, balancing gym and help students on the medicine application process. I'm an advocate for theism and my main aim is to help people live a happy and healthy life, and I'm hoping I can bring you on the journey with me. Alright, so welcome back guys, it's Cringista, first year medical student. Imagine, the last time I was filming this, my neck was out like this trying to record like a pterodactyl. Trust me, it wasn't nice. But anyway, if you're watching this video, it probably means that you have an interview coming up, or you've had an interview and now you're probably gonna cry once some of the tips I mentioned, or you think you're gonna have one, so I hope you do get one. But on to today's video, I'm actually gonna be interviewing 5 of the medical students at QM University, so some of my peers that I know or I've got to know for this video. Answers are really good. Some of them are gonna give tips on how to answer the questions, some of them are gonna give exemplars or close to what an exemplar should look like, and then I'm gonna summarize right at the end with a hopefully a banging answer. But before we actually get into today's video, I'd like to thank the sponsors of today's video, which is MedShark, essentially my own company, again, because I'm not getting sponsored like that. I have released a interview ebook, you could call it, which is £35 divided by 10. Take away 1p, so £3.49, because I know what it means to be broke and not have essentially a lot of money to essentially use on your medicine application. So if you guys do want to check that out, you can. Do remember I have put out a UCAT ebook as well, somewhat similar price, I think a little bit more, I think it was like £3.99, and it got 800 sales this summer because a lot of people had benefited from it, and it's not just like generic tips. But apart from that, let's actually get on today's video, and with no further ado, yeah. Alright, so Adam, Jazakallah khair for coming, may Allah bless you. I've said this twice now, but no problem. So the first question is, why medicine?
So why medicine? That's quite a common question that comes up in a lot of interviews from multiple medical schools. And medical schools, they know that they're going to get a similar answer for all of this. So try to be genuine, and that's all I can say on that. But try to pick a specific example of why you're picking medicine. No matter how insignificant it is, you think it is, as long as it's personal to you, you should be fine, inshallah. Because these interviewers, if it's not genuine and it's not personal to you, they'll pick this up because they've been doing this for years. So pick something genuine to you and personal.
Okay, so Habibi, Jazakallah khair for coming, may Allah bless you.
Shukran for having me.
But anyway, so the first question, kicking into it, why medicine?
So the reason why I chose medicine is because it's a very dynamic field, right? Unlike other degrees, unlike other subjects, it's constantly evolving, it's constantly changing, it's constantly improving itself. When we're working in other fields, we eventually hit a limit point. But in medicine, until we're able to treat every patient perfectly without any repercussions, without any side effects, we're constantly evolving and making ourselves better. Every day, we're inventing new innovative techniques to make drugs, to produce a better response to drugs, to handle conditions better and better. Things, for example, in the 1950s that would be fatal are now considered a mild inconvenience nowadays. And I found that really intriguing, the fact that these, that as a doctor, you can use medicine, you can use technology, you can use everything from how the patient looks, how the patient sounds, to their DNA, to kind of come up with a optimized response to treating them.
Now, if I was thinking about how I would go about answering this question, and you can probably tell Quringis is in like a conversational mode, is that this question is meant to be generic. Like, everyone's prepared a why medicine question, and it's all about, I guess, potentially being genuine, because they're able to tell if you faked it, if, for example, it's all about your continual learning, but in reality you're only playing games at home when they ask you for any experience. So I'd say the first thing is to remain genuine, and I think that's probably the most important, especially in being like true to yourself. The next thing that I'd potentially want to reinforce is that I have clinical experience and I know the realities of medicine. The reason why I'm saying this is because especially when I was doing my research, and you can check via websites such as FOI, Freedom of Information, then A100, then the university after it, you can check the scoring sheets on what they score you on. I'm not sure if you guys knew that, but like, I make sure that I look at them, especially for like Queen Mary, for Imperial, for UCL, and you could see that one thing that they mark you on is the realities of medicine. So the only way that you're able, or one of the main ways that you're able to determine whether you really do have the realities of medicine is if you know what the vocation entails. So that's another, and I'd just say initially when it comes to that question, because I know my peers are going to mention so much more, is that you prime them. Now in psychology there's a technique, and I know it sounds a little bit like whack, like sure you've done that in your interview, but trust me, it's all about smiling. You can tell sometimes when I'm smiling, if I was to smile, that's a fake smile, but if I was to actually really, a little bit more joyous, you end up smiling naturally yourself. So you end up, oof, oh no, my mic. Yeah, so my mic just went crazy, but nonetheless, like, you could tell when I'm smiling, you're smiling. And yeah, just give them that energy, give them that solid handshake. Obviously, if it's a man and you're a man, then give them a firm, solid handshake and smile, gas them up, compliment them, like you're looking really good, or potentially you just sound like amazing people if it's on Zoom. And you'll see a massive change in your score, especially if you begin with it. And yeah, that's it. So Abdul Majid, Jazakallah khair for having us on.
No,
miss you.
You too,
So the
thanks.
first question that I wanted to ask you is, why medicine?
So I thought long and hard about why medicine, and it was kind of a challenging decision that I had to make. Ever since I was younger, I've always loved sciences, biology, chemistry. It came really naturally to me. The whole process of sort of like figuring things out, the way the body works, I've always loved that. So from the get-go, I knew I wanted to pursue a field in science. But then I also love working with people and sort of interacting with different groups of people. And medicine is almost like the perfect blend of those two things. In my work experience, I ended up seeing how the doctor uses the scientific knowledge, the anatomy of the body, and how he uses it to better someone's quality of life. And having that sort of impact, being someone that a patient can rely on and lean on, that really inspired me. And I remember firstly seeing how a patient looked up at the doctor and how his life was changed for the better and how much of an impact it actually had on him. I aspired to do something like that. So using the science that I love, using the biology and chemistry that I love to improve someone's quality of life and working with people closely, that's something that I definitely want to do. And that's why I think medicine is the perfect career for me.
Alright, so Connor, I was going to ask you, thank you for coming, like I've said. But I was going to say, let's start off with the first question. Why medicine?
Initially, I wanted to do something that would be extremely hard, something that would challenge me in like a range of ways, not just in terms of intellect, but in terms of like interpersonal communication. I didn't get in first go, so I took a gap year to do some care assistant work, and when I was there, I found it really rewarding work to do. It was really humbling to be a part of someone's life, you know, nearing death in such a personal way.
So to initially kick off, I do believe that modern medicine does facilitate a lifestyle of continual learning, as cliche as that sounds, and also allows you to care for people. Now, displaying or care, or essentially catering for people's needs in terms of care, is no new experience to me. So in the case that I do mention in my personal statement that my father did suffer a fractured skull as well as that of a snapped clavicle when he came to the instance of the Finsbury Park terrorist attack. Now, at this case, it was emotionally straining. I'm not going to lie, I'm not going to pretend like I'm a robot. But I was essentially, in times, responsible for his emotional solace, as well as providing him with the painkillers and antidepressants to reduce his PTSD and intense vertigo. Now, yes, it was difficult, and yes, I did have to tailor my availability around that of my father. And I saw a very stark similarity when I went on work experience with one of my wrestling coaches. The alpha male, as people would assume, very big physically, but that when it came to that of his emotions, it was very in control. And the time that I went to view his consultations, as he was working as a GP in the UTC of Queen's Hospital, I do believe, the urgent triage care, I saw a very similar, or essentially a massively improved version of what I was doing for my father. So I saw that mere knowledge initially wasn't enough, and that it's imperative to genuinely connect with every patient in order to allow them to essentially feel that sense of comfort, to disclose sensitive issues such as potentially like self-harm or domestic violence. And I saw via his his genuine sense of care, visible through his appropriate sense of humor and intelligent smiling, if you could call that. And sometimes he would work as the patient's advocate in certain cases, in which he would tell them in a way that even me viewing it in the consultation would be like, it's such a compelling case. and sometimes he would crack jokes, appropriate level of jokes, to kids, in order to allow them to comply and to realize that it's for their benefit. And from this, I saw that doctors not only cater for the physical condition at hand, but also the psychological and hence the biopsychosocial model. And it was something that I thought, along with my other work experience opportunities, that this should be the profession for me. So, lovely tips on how to answer why medicine, but now if they were to ask why not nursing, for example, so I'll say that question.
So when they ask a question, well, why not this? The one thing you absolutely do not do is bash the other profession. Okay, you do not say, well, nursing is this and that, nurses are rude. Do not say that at all. Your interview is over once you say that. Okay, so for example, a question like, well, why medicine, not nursing? You would highlight the role of what medicine is, so what a doctor does, and then you'd highlight the role of what a nurse does, and then go a step above that. Okay, you would explain how nurses and doctors work in multidisciplinary teams and work together for patient care and the final outcome. So you have to explain both of these things and then make a judgment of why medicine is more attractive to you and becoming a doctor is more attractive to you than nursing or whatever they ask you, pharmacy or whatever. And that's how you should answer that question.
So one follow-up question that you may be asked in the real interview is why medicine and not necessarily nursing or a social care or biomedical scientist?
Yeah, so like the really important thing here is not to diss nursing. You don't want to start insulting it and saying, oh, it gets paid less, it's less qualified. That's a very wrong approach. Personally, for me, nursing is a lot more of the physical concepts, putting in cannulas, dealing with the charts, but for a doctor's job is more to do with the puzzle of it, and I'm a very big lover of puzzles. I love trying to find the solution and seeing what's wrong and just having a go at it. On the other hand, nurses are more what their job is to do the kind of physical aspect and take care of that side of things. But for me, I really wanted to have a go at breaking the puzzle. What's wrong with this patient? What's going on? And that's why I chose medicine over nursing.
So Abdul Majid, a follow-up question that some people may be thinking, why medicine and maybe not nursing or social care?
Yeah. So I strongly agree that nursing and social care, those are imperative and very important jobs that need to occur. I think that the healthcare field would definitely not function correctly without them, and I think that they are very vital and super important. However, for me personally, I prefer to take more of a leadership role, and I recognize that in the medical team, doctors have more responsibility over the care of the patient. They decide where the treatment goes and which direction to choose, and that sort of leadership side of things is something that I want to have. I think that when having experience, for example, as captain of my sports team or as head boy in my secondary school, I really like the idea of being someone that people look up to, having that sort of control and that leadership responsibility, which is something that doctors have over nurses. I also agree that nursing, they do a lot more of the physical side of things. However, the problem-solving aspect, like diagnosing the diseases and deciding where the treatment goes, that's something that I want to do a bit more of. So although nursing is an incredible degree in itself, I think that taking the more leadership role is something that I definitely want to do, which is why I choose medicine.
So important. All right, so Connor, I was going to ask you a sort of like potentially a follow-up question, which is why being a doctor and potentially not being a nurse?
I've seen in the care home that nurses are very limited in what they can actually do. They can make notes, care plans, all that sort of stuff, but they can't make a formal diagnosis, and they can make certain ones, but not all of them. And a lot of it relies on doctors, and there's a waiting procedure, and you're just limited in what you can actually do. Whereas I wouldn't like to do that. I would like to have as much an influence as possible and do as much as possible.
So guys, if you made it to the end of the video, you can tell I'm gassed. I don't know how that's happened. Hopefully you've benefited, and just remember at the end of the day, all of the why medicine questions are going to be subjective. They're going to be tailored to you, so you can't really go wrong unless you mention like financial reasons or reasons in the interview, because they're going to be like, is he trying to do it for altruistic purposes or is he trying to do it just to fill his pockets? And nonetheless, guys, I don't want you to like, I need you to like. So guys, please smash that like button and check out the other Q&A playlist that I do have available, and hopefully it'll be linked down in the description box. It might be on the recommended depending on how many people view it. With no further ado, Assalamu alaikum, peace.